Hey guys, Joe here, and today I'm going to tell you the number one thing to do or not do if you have low back pain. Before I start telling you the things you shouldn't do, I think it's important to understand the mechanics and the reasons why you should and shouldn't do certain things, especially with low back pain. Low back pain affects 1 in 4 people in the UK today, and worldwide the statistics are fairly similar. And so here we go. This is the back of the spine here. This is the front and this is the side. If you can understand the anatomy here, it will lead you in good stead going forward, and also massively help with regards to the low back pain that people or you, loved one, friend, family member are experiencing. So from the front here, these are what we call vertebral bodies through here, and there are about 5 in the lower back. This is the pelvis here, this is the front, this is the back. These are the sacroiliac joints. And the most important thing, and especially for regards to today's video, are these little joints here, which are called facet joints. And as you see, they don't move too much at all. Literature fluctuates quite a lot, but call it 5 degrees maximum they move. Therefore, with regards to it, how general movement occurs is like a concertina effect. So if you want to bend forward, all of these have to move together. We're supposed to have a nice curve in this low back, and the reason we have that is to distribute force down to this pelvis, big and strong, that then distributes outwards towards the feet. However, the number one thing to not do, or the number one way to injure yourself, is, have a look here, I'll come from this point, flexion, bending forwards, and rotation. As you can see, when we come forwards and rotate to one side, we just jam the joints on that side. Do that enough times over a week, month, year, they then create a lot of inflammation there, and that is the start of dysfunction in the low back, done a lot of times. So I'm a spinal specialist, chiropractor by trade, and many times I have patients say, Joe, I've had no pain for years and years and years, all I did was, and that will then be followed by brush my teeth in the morning, bent to pick something up. The most innocuous or the little things can really irritate because it's a cumulative build-up effect. So one thing I'll say, stop bending forward and rotating. That rotation doesn't have to be much, as you can see, 3 to 5 degrees. Bend from the hips, use your knees correctly, and you can then create better behaviours, better patterns, and going forward you can reduce down the symptoms and stop things from getting worse before they even become an issue. Hope that's helped, guys, and tune in for your next video to figure out how to not have pain in the first place.